In her lecture at the 93rd Nestlé Nutrition Institute workshop, Dr. Lynette Neufeld talked about the trends in the global landscape of malnutrition in infants and young children. Dr. Neufeld is currently the Director of Knowledge Leadership at the Global Alliance for Improved Nutrition. Malnutrition in children affects short and long-term survival, growth and development, and it has many forms. It can result in child stunting, affecting 151 million children under 5 years of age globally, which was reported in 2017. An important progress has been made in childhood stunting, wherein it decreased globally by 32% between 2000 and 2017. However, the burden remains high in many countries, such as Africa and Southern Asia. 51 million children under 5 years of age worldwide suffer from wasting, which is another form of malnutrition. Child wasting is highly prevalent in Africa and Asia. 38 million children below 5 years of age were overweight or obese, which was reported in 2017 on a global level. Childhood overweight and obesity is still increasing globally, even dramatically in some regions of the world. The highest rate has been seen in Eastern Europe or Central Asia, with an 80% increase between 2000 and 2017. Deficiency of micronutrients, mainly iron, which leads to anemia, folic acid, vitamin A and zinc, are highly common in children under 5 years of age. However, as Dr. Neufeld mentioned, many data on the prevalence of micronutrient deficiencies rely on old data, and only a few are reported globally. There is growing evidence that many countries are affected by multiple forms of malnutrition. The map on screen shows countries with a burden of at least one of childhood stunting, anemia, or overweight. Major determinants of malnutrition are well known. They form a complex interplay among various immediate and underlying factors that need to be addressed to improve the individual nutrition status, as shown, for example, in improving childhood stunting. Of those, detriments provide adequate support in politics that enable an environment for nutrition improvement, such as nutrition policies and political governance. Further immediate and underlying factors are related to food, social, health, and living environment. They all have an impact on the individual nutrition behavior, lifestyle, and biological factors. The progress in reducing anemia has been elusive. Anemia, a proxy used for iron deficiency, affects about 42% of children globally. High rates of anemia occur across South Asia and Sub-Saharan Africa, with 55% to 60% of children being anemic. However, children in other parts of the world are also anemic, but with a lower rate. What could be the reason for lack of progress in reducing the prevalence of anemia? One of the reasons is the complexity of the development of anemia, as Dr. Neufeld explained by summarizing own data from India. Iron is an important contributor to anemia. In all, 78% of children with anemia are iron deficient. However, other health-related factors, especially inflammation or further micronutrient deficiencies such as vitamin A, B12, or folate, are also involved in the prevalence of anemia. However, iron supplementation will improve anemia related to iron deficiency and not any other micronutrient deficiencies. Dr. Neufeld addressed an important aspect that will need further clarification. How will a child with anemia respond to iron supplementation in areas with high rates of inflammation? Dr. Neufeld concluded her talk by addressing action points that need to be considered in reducing malnutrition. In most countries, multiple forms of malnutrition coexist, which all have complex causes that need to be addressed by all relevant determinants. To better target the actual situation of micronutrient deficiencies, standardized, up-to-date data on their burden are required for many countries,